Hi, everyone, and welcome. My name is Dr. Anna Pace. I'm an assistant professor of neurology at the Icahn School of Medicine at Mount Sinai, and I direct the Headache Medicine Fellowship at the Mount Sinai Hospital. And today I'm lucky enough to be joined by my illustrious colleague, Dr. Zhang. Dr. Zhang, would you like to introduce yourself?
Hi, Dr. Pace. It's great to be here. I'm Dr. Nushin Zhang. I'm a clinical assistant professor of neurology. I'm also the chief of headache medicine at Stanford University. Great to be here.
Great. So today we're going to be talking about complementary and integrative medicine for migraine. I think this is definitely a topic that has really sparked a lot of interest, especially on the patient side over the last couple of years. So Dr. Zhang, can you tell me a little bit about what exactly complementary and integrative medicine is?
Yeah, there's actually many definitions of it. What we generally think about is non-pharmaceutical treatment approaches or healthcare practices that may not be part of conventional medicine. And the American Board of Integrative Medicine actually gives a very well-rounded definition of this. And what they basically say is that it's a practice of medicine that focuses on the whole person, and it should be informed by evidence and really make use of all of the appropriate treatment approaches that can help our patient achieve optimal health. And the name that we use to describe this field of medicine has kind of changed over time. So initially it was alternative medicine, then it was called complementary and alternative medicine, or CAM. And then the most recent term that we use is complementary and integrative medicine.
Or SIM, I guess for short. And I think SIM, based on what you're describing, sounds like it would really fit well with headache medicine in general when we're thinking about all of the different factors that could potentially contribute to or affect a person's headache frequency. So some of the things that we always think about are some lifestyle factors that can affect headaches. So do you have any data or anything you'd like to talk about in terms of some of the different lifestyle factors that patients can work on when they are looking to try to reduce their headache frequency?
I think first, we always want to think about, which patients, right, are the kind of a best fit for this type of treatment. So we think about, patients who may not have had adequate responses to their pharmaceutical treatments, or have poor tolerance to these treatments, or maybe some medical contraindication to medications. And we think about people who may be pregnant or lactating or planning pregnancy. And these treatments can also be helpful for people who have like medication overuse headache or exhibit significant stress and may not have adequate stress coping skills. So really the foundation is the lifestyle modifications. And the way that I explain it to patients is basically your migraine brain is hypersensitive, especially to change. And what it really likes is a very regular and predictable schedule for eating, sleeping, and also exercise. So specifically, what we see for exercise is about 20 minutes a day of aerobic exercise can actually decrease headache frequency and severity. So this could be anything from devoted time to walking, hiking, biking, swimming. Those can all be very helpful. And, for sleep, poor sleep quality, including things like insomnia, can affect about 30% of patients with migraine. So in our clinic, we always screen for any potential underlying sleep disorders like sleep apnea. We want to make sure our patients receive appropriate evaluations and treatment for those. And so what we find most helpful with sleep is just keeping the same bedtime and wake up time every day, Monday through Sunday. And then, of course, we get a lot of questions about food and nutrition. And the truth is, the evidence is just not strong in this area at this time, especially for any specific dietary interventions. We always counsel our patients to keep a very regular and consistent meal schedule throughout the day and to avoid skipping meals. And patients also love to ask about food triggers, but the evidence is not strong for what foods must be avoided. So in practice, what we find is that food triggers are very individual for people. So if someone finds that a certain food consistently triggers their migraines, then it would make sense to avoid that food. But in general, we don't encourage people to restrict their diet.
Absolutely. And I think the exercise and sleep comes up a lot in my clinic as well. And I think
Yeah.
in particular for patients who find that exercise may trigger their attacks or they're hesitant to do that because their attacks are so frequent, I often recommend kind of, gentler, low impact exercises like yoga, tai chi, or swimming, for example, which I think people find a little bit easier to kind of warm up to or incorporate into their routine. And so really focusing on good sleep hygiene and even things like trying to wind down before bed and having some type of routine is really helpful. I have had a number of patients come to me and ask, well, is there anything, like vitamins or herbal supplements that I can take to try to help prevent my attacks? And, there are quite a number of them that have good evidence. What do you usually recommend for your patients?
Yeah, I'm glad you brought that up. There's, I would say, four that are evidence-based and very helpful for our patients. So one of them is magnesium. That one has level B evidence. We think it helps with calming down neuronal hyperexcitability and preventing cortical spreading depression. Some of the formulations we like are magnesium glycinate, magnesium oxide, and citrate. And we do want to watch for any loose stool or diarrhea. Those are some of the common side effects that can potentially happen. And the daily dosing is about 200 to 600 milligrams per day. Other than magnesium, we also have vitamin B2 or riboflavin. So that also has level B evidence. And it's very well tolerated by people. Some people do get very bright orange or yellow urine when they take it. And the dosing is around 400 milligrams. And there's also coenzyme Q10, which is level C evidence. It plays a role in the electron transport chain and may play an important role in sustaining mitochondrial energy stores. It's also very well tolerated, and the daily dosing is about 300 milligrams. The last one we have is something called feverfew, which is a type of chrysanthemum, and this also has level B evidence. We think this may have some anti-inflammatory properties. Some people do get GI side effects with that, so you do have to watch out. We don't recommend this one during pregnancy because it can cause early contractions and potentially miscarriage. And the dosing for that is 50 to 300 milligrams.
Yeah, it's great that there are so many different nutraceutical options for migraine prevention. I personally find the combination of magnesium and riboflavin to be a good one that I tend to start with. I think nutraceuticals come up quite a lot. I have a lot of patients who ask me about them. Are there any patients in particular that you think would benefit most from nutraceuticals?
Yeah, I think similar to what we talked about before, a lot of our patients just don't tolerate some of the pharmaceutical treatments that we have. So this would be a good option to start with. And, one thing I always ask my patients to keep in mind is that the improvement can be gradual with these supplements. So really like any preventive treatment, you want to give it up to 3 months before, someone may actually see maximum benefit.
Agreed. I think it's hard sometimes to wait that long, but when they do, it really can help. I think one of the other SIM treatments that have really great evidence in migraine prevention are the behavioral therapies, which we think of things like cognitive behavioral therapy. But I'm curious what your thoughts are about those and whether or not you recommend patients actually utilize them.
Yeah, I think those are terrific options. Honestly, I think one of the challenges for providers is how do you broach this topic without making your patients feel like you're dismissing their experience as psychiatric or psychological? And I think one way to approach this is to really help your patients understand that the contributors to their headaches are usually partial and additive, and that things like stress, anxiety, mood disorders can have a significant impact on their headaches. And that's why it's really important that we find effective ways to address those. And what's great is that now we have really the highest level of evidence showing that specific biobehavioral treatments, such as cognitive behavioral therapy, biofeedback, and relaxation training, they are all effective preventive treatments for migraine.
Now, as far as I understand, it sounds like, patients who have migraine who may also have anxiety and depression may benefit from these. But do you ever see patients who don't have a history of anxiety or depression actually utilize any of these therapies and find them helpful just for migraine?
Absolutely. I would say with relaxation training and also biofeedback. These are great because you can not only use it as a preventive treatment, so things that you practice on a daily basis for prevention, but also reach for them as acute treatment tools when you feel that migraine escalating or the onset of migraine.
Yeah, I think that sounds great. And I agree. I find that sometimes broaching this topic with patients can be a bit challenging because, on the one hand, you want to be able to validate their experience, but at the same time, helping to target some of the, potential mood components of their presentation, or, the anxiety that comes with having a migraine attack with aura, which I see very commonly, and I'm sure you probably do as well. And using things like relaxation therapy in the moment during an aura, I think can be incredibly useful. One of the other things that I always get asked about is acupuncture, and whether or not there's evidence for that. And that one in particular, I seem to get that question by a lot of my pregnant patients. Do you have any experience recommending acupuncture to patients? And what do you think about the data for that?
Yeah, we are very data driven. We want to provide evidence-based treatments for our patients. Acupuncture actually has pretty good evidence for its use as a preventive treatment in episodic migraine. There's still sparse evidence for using it to treat chronic migraine, or to use it as an acute treatment. So when it comes to treating episodic migraine with acupuncture, there's actually an excellent 2016 Cochrane review that nicely summarizes the evidence for acupuncture in this for this treatment. They looked at 22 trials with almost 5,000 patients and found that acupuncture is slightly more effective than sham in reducing frequency of headaches, and at least similarly effective as some of our standard prophylactic medications.
That's great. As far as I know about the data, it seems like it would be a good option in addition to perhaps the traditional therapies that we are using, like oral medication. And similarly, yoga also comes up in the same conversation, and whether yoga can be useful. Again, also for my pregnant patients, a lot of my patients ask me this question. Do you ever recommend yoga to patients?
Well, with yoga, I think there's still a lot we have to learn about in terms of how does it help our patients with migraine. At this time, we just don't have that much robust evidence for that. But there was a randomized clinical trial that was published in Neurology in 2020 that looked at the effect of yoga as an add-on therapy for episodic migraine. So they basically had two groups. One was a medical therapy group, and the other underwent medical therapy for migraine treatment as well as yoga. And what they did was they had the yoga group, I believe it was to practice a pre-designed yoga intervention 3 days per week with an instructor at a center. And then this was followed by, I think, 5 days per week for 2 months at home. And they looked at over 100 patients for this study. And in the end, when they compared the medical therapy group to the yoga group actually showed a significant decrease in headache frequency and intensity, and in some of the migraine disability scores. So the conclusion was that yoga as an add-on therapy for episodic migraine may be superior to medical therapy alone. So I think this is a very promising beginning in terms of the research, and I really hope that we get more studies like this done in the future.
Yes, and I think it really illustrates an important concept that I think many of us kind of ascribe to, and that, it's really important to think about the patient, what their lifestyle is like, and, what they feel comfortable with in terms of a treatment regimen, and how important it is to really create an individualized plan for them. I personally use often a combination of pharmacologic treatment and non-pharmacologic treatment. So the fact that that study showed that yoga was great in addition to, traditional migraine therapies really just kind of hammers that point home for me, in terms of using even some of the other therapies that we've talked about, in addition to, our traditional oral or injectable therapies for migraine. Would you agree?
Right. I totally agree, Dr. Pace. I think some of the most helpful treatment plans that we come up for patients are those that integrate both pharmacologic tools as well as the non-pharmacologic tools that we have. And I think part of why I love headache medicine is that we actually get to personalize these treatments for our patients.
I completely agree. And with that, I think that's a good place for us to end. So we thank you all very much for joining us.